Only mode.
Good evening, everyone. Welcome to the Orange County Department of Health's second listening session for 2022. I'm Danielle Mosier. I'm the Senior Public Health Educator at Department of Health, and I would like to welcome all of you. We have our Commissioner, Dr. Irina Gelman, also here, the Director of Community Health Outreach, Jill Boyd. We have one of our epidemiologists, Erin Ray Pasquaretti, and one of our community health workers, Maricela Vasquez. And to my left is Daquan Crandall. He is also an epidemiologist who will be sharing the mic with me this evening. So I just want to welcome everybody who's also at home, and we also want to welcome Assemblywoman Aileen Gunther. Her office has logged on to the webinar. I'm not sure if Assemblywoman Gunther can be on, but if she is, we will be answering any questions from their office as well. So again, stop me if you have any questions while we go through the presentation. We are going to give you an overview of the health department, our programs, and our services. And then we are going to talk to you a little bit about the community assessment that we do every 4 years, which we gather information and data on health. And we're going to tell you how we put that document together, and that our listening sessions now are going to be geared towards putting information into that document. So we're here, we want to hear what you have to say, we want to know what you think, and we would like your input. We do also have some activity that we're going to have you do towards the end, which will be more hands-on, so you can see kind of how we choose our priorities. So, you want to?
Yeah, I got it.
Yeah. It's hard for me to do this and this.
Okay.
So, our mission at the health department is to monitor and protect the residents of Orange County, to prevent disease and disability, provide education regarding healthful living, and assure a healthy environmental conditions. We have our main office where our commissioner's office is, and our nursing division, epidemiology, intervention services, environmental health are in our Goshen office. Most people are familiar with that office on Main Street in Goshen. And then we also have satellite offices. We have one here in Middletown up at 18 Seward. We have one in Newburgh at 130 Broadway, which is behind the DMV building. And we have one in Port Jervis, which right now is on Pike Street, but will be moving to another location shortly within a month or so, Sussex Avenue, which are all very accessible and walkable for the public. So I know that most people are familiar with some of the services that the health department offer. I also know that you are very familiar with our COVID response and our large vaccination clinics. However, there are many other services that we provide that I think maybe sometimes people aren't aware are the health department, or that we even provide. So we just wanted to make sure that we come out, we reintroduce ourselves post-pandemic to make sure that you realize that we are still here and we have other things that we want to make sure that you know that you have access to. So we have several divisions in the health department that I'm going to go through just to get you reoriented. So community health outreach, which is near and dear to my heart because that's where I am housed out of. Community health outreach has a goal to foster behavior changes to promote and reduce risk of disease. This is where we house all the public health educators and our community health workers. Community health workers are what we call our boots on the ground. They are our grassroots efforts. They are doing direct outreach on the streets. They are going into people's homes. They are case managing, sometimes long-term, sometimes short-term. And we have many programs. Some are county funded and some are grant funded. So we have a mixture of those programs which are all integrated and work very well as a team together. Changing behavior is probably one of the most difficult tasks we have at the health department. So I can stand up here all day and give you lots of public health information, educate you on many different topics. But for me to get you to go back to your homes and change your behavior is a very difficult task. And to find out that you changed your behavior, also very difficult task. So it is very important to us that we do give you all this information, but we also get your input, and then we can see some of those behavior changes just surely by data, numbers, and some different things changing in the community. So some of the programs that Community Health Outreach is responsible for are things like Healthy Neighborhoods, which will come into your home. It's a home visiting program, outreach and home visiting. They will come in to make sure the environment in your house is healthy. Make sure that you don't have, you're not suffering from any environmental things like mold and lead paint and possibly pests. So we will work with code compliance in each of the towns, villages, cities, municipalities to make sure that the landlord is providing an appropriate living space for you and that you know how to keep your living space appropriate. Make sure you're safe from carbon monoxide, poisoning, things like that. We also have a maternal infant collaborative, which works with women of pregnant and parenting age and their children to up to 1 year after they're born, making sure that they get all the services they need, whether it be prenatal or parenting. It could be anywhere from nutrition to making sure that they're getting to their prenatal appointments with the doctor, teaching them about breastfeeding, and hooking them up with services that they may need in other parts of the community. We also have childhood-led prevention and some of our lead-safe programs, which will work with any parents who have children who are lead poisoned or have a high lead level, which they will get tested at their physician. And then we will send community health workers out to meet with the parents, educate them on what's happening with their children, and to mitigate any of the lead, remediate the lead that might be in their home as finding out where they possibly may be getting the lead poisoning from, and then working with them to make sure the kids become lead-free, whether it be through medication and working with the physicians. We also do lead inspections. Our environmental health division provides a lead inspector to community health outreach to go out and do lead inspections in the homes. We have chronic disease prevention programs. We also have a health literacy program, which Maricela is part of. Our health literacy program is working with physicians, healthcare centers to make sure that the information that they're giving their patients is easy for the patients to understand, that they're asking their patients all the questions that are meeting their needs, and that the patients also know the questions to ask their physicians. We're making sure that they have primary care, that they're being, they're meeting all of their assessments that they need each year, and that they also are going for COVID testing and vaccinations if they have not already. We also have offices our satellite offices are also in Newburgh, Middletown, and Port Jervis. We have a community health worker in each office, and our number is, I think we took it off the screen. We'll share them at the end, and you can call and make an appointment to have someone come out to your home and do assessments. We also, under the Community Health Outreach, we also have Healthy Orange, which is our chronic disease prevention program. The goals of Healthy Orange are to make food that's healthy more accessible to the community, to ensure that there are opportunities for free and no-cost physical activity in the community, and also to make sure that people are able to live a tobacco-free life, have tobacco-free environments, to be able to quit smoking, and to make sure that stores and vendors are up to date on their tobacco sales license, and to make sure that they're not selling tobacco or vaping products to minors. Intervention services. Intervention services, their goal is to enhance each eligible child potential for growth and development, developing family member skills, and providing a stimulating and nurturing home environment. Early intervention provides education and training for families of children from birth to 3 years of age that may have a developmental delay. That is at no cost to the family. So generally what will happen is when children visit their pediatrician and the pediatrician assesses them for milestones, if they're not meeting their milestones and the physician feels that there's a concern, they will make a referral to intervention services. Parents may also notice that the children aren't reaching milestones or have some concerns and can reach out to us as well. And sometimes a preschool teacher or a teacher in elementary school may also notice. So there are different avenues that the referral and assessment will reach intervention services. Intervention services will send out a team of people. So they have a service coordinator that will make sure that people come out to assess the child, determine if there is a delay and if there's a need for additional services to carry in. And the services generally that will happen are either physical therapy, occupational therapy, speech therapy. Some special ed services are available. So once that child becomes 3 and they're ready for preschool, then the preschool will, and once they reach elementary school, we have service coordinators that will work with the school districts to make sure the child is getting all the services that they need and that they're being assessed each year to see that they are caught up to their developmental progress. Thank you. Emergency preparedness. This obviously will prepare people for and respond to public health emergencies. They work closely with our Medical Reserve Corps and county, state, and regional agencies to coordinate responses to disasters. The Medical Reserve Corps is a volunteer group of health and mental health professionals that assist Orange County Department of Health in the event of large-scale public health emergencies. And if anyone is interested in joining the Medical Reserve Corps, there is the email. I'll leave that up there for a few minutes. And I know people generally don't think of disasters and health and that they're going hand in hand, but I think after the pandemic, you can see how some of the emergency agencies, police, fire, ambulance, hospitals, healthcare, our emergency services would work hand in hand with health. So in order to put on, let's say, for instance, large-scale vaccination clinics, you are going to need lots of medical personnel. You're going to need lots of people to accommodate all of the people coming in. You're going to need large space. You're going to need people there for any emergencies that might happen. So during the pandemic, I think that was much more obvious how connected that we were. However, even pre-pandemic, if there was a disaster, it could be a hurricane. So if a hurricane occurred and people possibly lost power and there was a tremendous amount of flooding, roadways were blocked, that does affect people's health. If there's flooding, that could cause sewer systems to flood into the drinking water. There could be unhealthy water in the streets. People may not have access to healthy water. So that becomes a public health emergency if people don't have access to healthy water. And there are flood waters that could come from sewers and other unhealthy waters carrying debris across the roadways. Also, people who don't have electricity or can't get out of their homes or don't have food, that also becomes another public health emergency. Hi, how are you? Come on in. So, again, people need to also be directed possibly to a hospital or a doctor. There could be injuries, and they may not be able to get there. So health needs to make sure that people are getting to health services, so they have to coordinate with emergency service, fire, police, hospitals, ambulance, to make sure those people are getting access to health care. Environmental health. I think this is probably the division of the health department that most people are familiar with. These are the health inspectors. They are our sanitarians and our engineers that go out and do restaurant inspections, amongst a lot of other things that we're going to discuss in a minute. They have two sides to their division. They have the engineering side, and then they have the sanitary side. So they have a lot of responsibilities that fall under their jurisdiction. Their goal is to protect the health and safety of our residents and promote a safe, healthy environment. So they need to do inspections on restaurants, yes, and they do surveillance of restaurants and anywhere that would serve food, temporary food establishments also. They do a surveillance of all public water systems. They have to ensure that your water, whether you're drinking it, bathing in it, or swimming in it, is healthy for you to consume or to use. They inspect children's camps, hotels, mobile pet homes, recreational parks, campsites, swimming pools, bathing beaches. These are venues that people come in contact with each other, with water, with bathrooms, with other environments, that they have to make sure if you're coming in contact with each other and the environment that it's safe for you to do so. They also do tick identification. and insect and rodent control. They do investigations of nuisance, hazards, and animal bites. I'm sure someone here probably has had a tick on them and has brought it to our Goshen office, and you go up to the third floor and somebody has identified it for you. So they're very instrumental in making sure that that is done. They also are responsible for any animal bites, and they'll report it and work with our nursing department on that. And they also do our residential lead evaluation, which I had said before. They make a sanitarian available to us to go out and do lead inspections on homes to make sure that there's no lead-based paint in some older homes, and we'll work with the landlords or the homeowners to help them remediate that. Epidemiology and public health planning. That is one of our newest divisions. We have had an epidemiologist for quite some time, Jackie Lawler, who isn't here with us today, but some of her team is here with us. And as the pandemic progressed, we realized we needed to expand that team, and luckily we have been able to do so. So that team, their goal is to provide data to shape policy decisions, the county's health agenda, to identify priorities for the community, which you're going to see kind of live and in person today. They study the patterns of disease, causes and effects of the disease and conditions in Orange County. They conduct our community health assessment, which is a very large document that is put together every 4 years of all of the data on health, any health aspects that you could think of in the county. We collect data on it. That informs how we're going to address some of the strategies and concerns that we have in the community, gaps that might be happening, services that might need to be reevaluated, any barriers, any successes. And we put this into this very large document, and the staff, some of them here, are going to be working on it. It is a lot of work and a lot of data collection, but what it does is it informs us how we're going to approach health for our community residents. We generally, every 4 years, will go out and do surveys in the community. We have some agencies that will help us with surveys, with larger scale surveys, but we want to bring our services to you in these listening sessions, so you're going to be really instrumental, the community, on filling out surveys and participating and giving us input, and we're really excited to hear what our residents have to say. We also, in this division, monitor the occurrence of infectious disease through surveillance and investigation, develop strategies for preventing and controlling disease, and work to put those strategies into action. So the epidemiological team will also, they're disease detectives. So when an outbreak of some sort happens, it doesn't have to be as large scale as, a pandemic, but it could be some sort of, salmonella outbreak at somewhere. They need to pinpoint where that started. Where did it start? Was it a food source? Was it a person? And they investigate, collect a lot of data, and then work to follow the trail of that disease so we can figure out how it shouldn't happen again, to prevent that from happening in the future. So they have a really cool job that they get to kind of play the detectives for us. Health equity. So this is also a fairly new division to us, probably in the past 5 years or so. We are very fortunate to have a division. Not every health department has a health equity division. The goal is to improve the health of the minority populations in Orange County, and very simply. And our health equity director couldn't be here tonight, but she will, going forward, be at our listening sessions. The goal here, when we're working with the minority populations, is that they generally suffer from more adverse health outcomes in the community by the nature of many different aspects. So we like to look at what some of the barriers are to their getting access to services, access to healthy food, access to transportation, things that might give them better health outcomes. And we do a lot of research. We work with a lot of agencies. We are hoping from this listening session we'll gain some more knowledge. We have community health workers that are out in the field talking to people. They're in their homes, trying to assess how we can give them better access to the health services and the public health programs that we have. And it has become even we already knew this as the health department. We already have programs in place, but it became a lot more obvious, I think, to everyone in general during the pandemic that unfortunately the minority populations were suffering the most because they couldn't get access to vaccine, they couldn't get access to testing, simply because of some of their competing priorities. So imagine you're someone who has barely enough money to pay the rent, and you have childcare issues, and you have no transportation, and you can't afford a copay. These are things that keep people from going and seeking out healthcare. We want to look at those things. We want to try to look for funding to help those things and look for agencies that are going to aid us and making sure that those are no longer barriers for people. And these are our social determinants of health. These are some of the things that people are focusing on. These are some of those competing priorities and some of the things that affect why the healthcare delivery or the healthcare access is not even across the board for everyone, and why some of the minority populations are suffering more adverse effects. So our Health Equity Director will take a look at the social determinants of health for each community, for the populations, and gear some programming towards making sure we're addressing those for the people in those communities. Medical examiner. They investigate deaths to ensure accurate cause and manner of death certification. They will investigate accidents, whether they are motor vehicle, drugs, and other accidents, any death that is not due to 100% natural causes. They also investigate death at the workplace, death unattended by a physician, sudden, unexplained, unexpected or suspicious death, suicide, and any therapeutic misadventure. Our medical examiner is in Goshen, and I'm sure you guys understand, and I don't have to go into too much detail, and we generally don't show any pictures or slides from their office anyway, so we're fortunate to have that. We went from many, many years ago, a coroner-based model to the medical examiner. Public health nursing. I think this is probably, aside of our health inspectors, is probably the most commonly known part of the health department. And I say that because everywhere that I go to do a presentation, everyone always asks me, oh, you work for the health department, you must be a nurse. I'm not, but there are other people that work at the health department, but everyone kind of recognizes nurses from our health clinics. And I think, and from a lot of our vaccine clinics, people, our nurses were giving the vaccine. So I think that is a very familiar face to many people. Our nursing division, their goal is to promote health and prevent disease to protect the health of the Orange County residents. They provide preventative health services in homes and clinics. Home care services are provided to residents diagnosed with tuberculosis and need direct observation therapy. Clinics are available by appointment for immunizations, tuberculosis, and STIs, which are sexually transmitted infections. So here is a list of our immunization clinics. It's also included in your presentation. So we have immunization clinics twice a month, Middletown and Newburgh, for children ages 2 months to 18 years old, and geared towards uninsured and underinsured residents. We have adult and travel immunization clinics once a month in Middletown, and it is by appointment. It's for adults. So if you're traveling outside the United States and those countries that you're going to, you're going to require immunizations to go there safely, that is the clinic you'd be attending. We have the tuberculosis TB control. That is once a month in Newburgh, all ages, for underinsured and uninsured residents. And we have HIV counseling and testing. That is weekly in Middletown and Newburgh. It is anonymous and confidential. That is by appointment. And we have the STI, or sexually transmitted infections. That is weekly also in Middletown and Newburgh. That is also confidential. So, are there any questions up to this point on the programs and services that the health department provides our residents? Okay, I'm going to turn over the second half of the presentation to Daquan, and he's going to explain to you about this large community health assessment that we've been talking about, where we're hoping you're going to give us a lot of input for.
Were there any questions online?
Not at this time.
Okay, thank you. So hello, everybody. My name is Daquan Crandell. I work with the health department, part of the epidemiology division. I got to kind of like crouch down. It's been a while since I've been on a mic like this before. That's all right, no problem. So to begin, I'm going to be talking about the community health assessment. It's a part of the, it's a community health assessment and the community health improvement plan. So that's the CHA and the CHIP. And then at the end of this, we're going to give you guys a quick short survey. And for those that are at home, you can't do it on paper, but we do have a digital copy, which I will put a QR code on the screen at the end of the presentation as well. And this is to gain your input and view on the community. We do this about every 3 years. It used to be 4, now it's shortened down to 3, and we do this in conjunction with the hospitals and all local health departments in the New York State, as well as community partners. So let's talk about the community health assessment and the community health improvement plan. Oh, I could DJ, we could do this. Okay. So what is the purpose of the community health assessment in the first place? The purpose of the community health assessment is to gather and review information about the community's health and well-being. It will be used to help understand the health needs of the county and find pockets of inequalities, places or people who places or people with worse health outcomes than others. So one of the ways that the community health assessment will be beneficial is that it gives a lot of data and information that can be used to acquire grants. In order to get a grant, sometimes you must justify why you need a grant. So we need to have information to kind of back up why we're trying to move ahead and create or improve a service that's inside of this community or any community. Okay, and then it takes about 1 year to compile all the information once we have it all gathered, and then we have to organize it, and then we can figure out which areas that we need to focus on between each community. Okay. And this also works in part with the CHA, which is the community health assessment, and then it works in hand with the community asset survey. So it's part of it as well. So the people who are out in the crowd, in your folder, you will see a colorful flyer. And on that is the community asset survey, which you could do digitally or via paper copy. Oh, I can tilt it up like that. That's good. That's good. All right. Alrighty. I mean, I was all right. I like to lean down and get personal with everybody out there. I'm trying to help everybody. With the flyer, like I said, it has a QR code and it'll be digitally or a paper copy. And for those that are at home, like I said earlier, I'm going to put the QR code on the last slide so that everybody can take a chance to take the community asset survey. So let's talk about what the community asset survey is. So the community asset survey is a tool to help measure the strengths and areas of improvement of a community. This short survey allows Orange County residents to provide their input about the health of their community. Okay, and then basically all the information from the community health assessment and the community asset survey will then be pulled together, and then that will help create what we call the community health improvement plan. So that is the CHIP. So what is the purpose of the community health improvement plan? Well, the community health improvement plan is a long-term plan to address public health issues identified in a health assessment. It is a collaborative process between the health department and many diverse stakeholders, such as hospitals, community health organizations, to help combine resources to help improve specific health indicators faster. Okay. Is there any questions on the CHA, the community asset survey, or the community health improvement plan? Okay. Is there any questions online?
Not at this time.
Okay, thank you. So this is where the fun part kind of comes in, and I'm going to explain like rock voting. And for the people at home, just because you are not here right now does not mean that your opinion does not matter, and that is why we're going to do like the digital, which is going to be the community asset survey, which are going to be talked about the same 5 priority areas that I'm going to discuss in a moment. So you're probably wondering what is rock voting in the first place, so let's talk about the purpose of rock voting. Each year, the New York State Department of Health Health chooses 5 priority areas to focus on over the course of the next 5 years as part of the state's health improvement plan. And these 5 priority areas, like I said, are going to be discussed on the next slide. But for the people that are in here, if you go inside of your folder, there's going to be a pamphlet that has each priority area and a brief description of it. And then when we talk about the ROC voting process, you'll see that up there as well. So the Orange County Department of Health is going to use ROC voting as a creative way to gather residents' votes and feedback on which 2 priority areas are most important to the community. So what's going to happen for the people who are in here is that when we're going to do the ROC voting, that's going to be taking place at the end. You'll come up on your right-hand side, actually it'll be your left-hand side in the corner, and you're going to see 5 jars on the table. Each jar is going to represent a priority area, and as well as a description of each priority area that I'm about to discuss on the next slide. And then the Orange County will then use this information gathered from the ROC voting that we're going to do here today to help choose the 2 areas to focus on as part of the health improvement plan for the next 3 years. So this is going to be a combination of the community health assessment, the community asset survey, and the ROC voting. So that's all information and all data that's going to go inside of the community health improvement plan. So then we can try to figure out the 2 main areas that we need to focus on as a health department so that we can give out to the community. So I'm briefly going to talk about the 5 areas. And again, if you haven't done so in your folder, there are the 5 priority areas. So let's talk about them. So the first priority area is going to be prevent chronic disease, and that consists of healthy eating and food security, physical activity, tobacco prevention, chronic disease preventative care and management. The second one is going to be promote a healthy and safe environment, and that includes injuries, violence, and occupational health, outdoor air quality, built and indoor environments, water quality, and food and consumer products. The third priority area is going to be promoting healthy women, infants, and children, and that is going to be maternal and women's health, perinatal and infant health, child and adolescent health as well. The fourth priority area is going to be promoting well-being and preventing mental health and substance use disorders. So that consists of well-being and mental and substance use disorders prevention. And the last priority area is going to be preventing communicable diseases. So that is vaccine preventable diseases, including HIV, any STIs, so sexual transmitted infections, hepatitis C virus, and any antibiotic resistance and healthcare associated infections. So these are the 5 areas that we are going to be focusing on. And again, this is given from New York State. And these are the 5 areas that we will have up here inside of the front for the ROC voting. And for the people at home, because you can't do this activity, we do have the digital activity, and we will click over now. And I'll put the QR code up. So for those of you that may not know how to use the QR code, if you take out your phone, you pull up your camera. If you pull your camera straight up to the screen that you're looking at right now and face it on the QR code, you should see a pop up on your browser. And then from there, you just put your information in, and it's a quick survey. And it takes about like a couple minutes, 2 minutes, about 5 questions. And then that will give us more data and more information on how we can reach out to the community and try to figure out what disparities are happening there. Because at this time, we're post-COVID, and we're trying to come back and reconnect with the community and try to figure out what type of issues that anybody's going through health-wise, so that we can then reach back out and do our part. And at this time, we'll leave it open for any questions that anybody may have online, or anybody inside of this room right now that would like to speak. Does anybody have any questions or any input they would like to add?
Okay.
Yes.
Hi, I'm a resident and also an employee in this county, and I'm wondering, where does COVID lie in this ROC voting assessment?
So COVID-19 as in like vaccines, or Just in general, so that would be preventing preventable communicable disease. So you'll see the vaccine needle on the table right over there.
Okay, all right, thank you.
Not a problem. And Linda?
I just wanted to thank you for making the survey short.
You're welcome. All right. Are there any questions online?
Not at this time.
So for those of you that are here and that are at home, are there any other health concerns that you have? Any health issues that you want to discuss while we're here? Any health services you feel that might be needed in the community? So we're doing a really good job, is what you're saying. Thank you.
Thank you.
Okay, we're going to go now.
I'm going to definitely say more mental health.
Okay.
For sure.
Yeah.
Most definitely. Okay.
Educational outreach of COVID and safety in schools.
Okay.
Okay, that's interesting.
And just to let everybody know out there, we are taking notes on any questions because that's going to be part of the data collection. So we have our team up in front. So any questions that anybody might have or any input will be recorded and evaluated inside the Community Health Improvement Plan.
Does the school give information on COVID issues or concerns they're having on a regular basis? And do you use that for mental health follow-up for the students?
Are you asking if they give us the information or if they give the families the information?
If you have to call them to, see how the students are doing, because I think this made a profound impact, some good, some bad, I think. My grandchildren did wonderful.
I'll jump and take that question. Good evening. I'm Dr. Gelman. I'm the Commissioner of Health for Orange County. Thank you for being here, first and foremost. I think it's a wonderful opportunity to re-engage the community post-COVID, but I know there are a lot of lingering COVID questions. So as far as COVID in general within schools, we'll just separate the question just a little bit. We're predominantly dealing with COVID, communicable disease, and we monitor for over 62, 64, and counting now communicable diseases with syndromic surveillance, via various means. The way the Orange County Department of Health interacts with schools is typically through school nurses or through immunization surveys. So generally speaking, we come in contact now, obviously, with the pandemic setting. We notify schools, and we have a very robust wastewater surveillance project throughout the county. We actually have one of the most robust wastewater surveillance projects specifically for COVID-19 in the nation at this point. There are over 400 generally collected sites throughout the country, and we have 6 of our locations in the most densely populated municipal water sourcing areas throughout the county. So what we utilize that information, that data for, when we see an increase, a consistent and persistent increase in the viral burden in wastewater, we typically notify municipalities where we're detecting this, again, our most densely populated areas all throughout the county, and we notify a lot of our vulnerable and congregate settings at that time. So once we detect that consistent increase, we notify the municipality so they can put out public health alerts for the public, for the general public. We put out our own public health alerts to the general public, and we also notify congregate susceptible and medically fragile, medically vulnerable settings. So for instance, schools are included in that, hospitals in those areas, medical facilities, large medical facilities, and any congregate living facilities, so OPWDD, other congregate settings. So that's our interaction with schools. It's not limited with that because obviously throughout the duration of the pandemic, we have put out, whether that was protective measures or we have implemented sort of fail-safes. But generally speaking, the line of demarcation between schools and public health, typically what dictates what goes on in the schools, besides the local school boards, obviously, and they take their direction from the Board of Education, so the state ed board, and also our extent of the interaction is just with the nursing division as far as communicable disease and immunizations, where they're compliant with New York State immunization law. Now, we do have a Department of Mental Health and Social Services, which is a very distinctly separate and different department from the Department of Health. Because the state has identified mental health as one of the priority areas, we do work together with the mental health department, but a lot of those support services, a lot of the clinics that you hear about that are located within the schools or co-located within the schools, that falls under the purview of the Department of Mental Health. So I don't know if that kind of fully answers the breadth of the question.
It
No.
doesn't, but it makes me feel, not, I guess uncomfortable would be the word, because I feel this has impacted young people a lot. And as a parent and a grandparent, I could actually see where this could end up. And are we going to,
When you're saying this, you mean?
the fact that they're homeschooled and they're not, haven't been with their classmates for over a year, they're home with their parents doing their studies privately most of the time, is that going to impact their social skills, their brain development, how to socialize? You know, they ate lunch with their friends every day in school. Now they're eating with their families, so.
So over the last year and a half,
Prepared, I mean, I think, I don't know who's accountable, who's responsible, who I should be speaking to, but how can we address as adults with children and we see that we're gonna watch out for you because this has affected you? Your lives are never gonna be the same after.
so you're talking about long-term mental health impact. So, right, so that's within the Department of Mental Health and those clinics that I've mentioned that they have co-located within the school districts that have those on the mental health end, long-term.
To go back on the other side of like the high level in that community and how you're going to
Yes.
what is the threshold of being a max number? Because I know that's been kind of changed throughout the course of the 2 years.
Absolutely.
What does that mean when we're at a severe or at a red state in our county?
So, for instance, and it's changed quite drastically because clearly we went from PCR, provider-administered test in the beginning of the pandemic to now home testing, saliva testing, and everything in between. So the home tests and the saliva tests are not reported to the health department, whether local or state. So those numbers have not continued. They kind of stalled. We are still receiving PCR and provider-driven tests, but obviously they don't account for the actual community-acquired transmission rate. So that's precisely why over a year and a half ago, we've started this wastewater surveillance project, because that wastewater surveillance project, and we do have a link available both on our Facebook page and our website to that dashboard, and that's actually monitored through the Syracuse University, which measures that and puts out the data. But that actually shows the exact viral burden at the time, and we were able to fairly accurately predict the last Omicron wave about a week to a week prior to seeing that increase. So we no longer measure it in the case positive, as you've mentioned before. There's really no threshold as far as positivity value anymore, because as I've mentioned, those home tests are not accounted for, plus they're not truly indicative of actual transmission currently throughout the community. So that wastewater surveillance project prior to Omicron wave, we were able to notify most of our municipalities at least, I would say 3 to 4 weeks prior to really seeing that surge. And what we were looking for is a persistent increase without having a decrease post. So it's measured every week. We have those values, and those values continue to consistently go up throughout the duration. So as soon as we've seen 3 weeks of continued increases, we have reported those to the municipalities. So it would either take that or a drastic uptake. So for instance, last week we've seen a drastic uptake, 90% or more within Goshen, for instance. And we were able to notify that municipality and the susceptible, vulnerable congregate settings there. So similarly, if that was to take place in Middletown, Warwick, Port Jervis, Newburgh, we would similarly notify them. So it's either a drastic large increase or a persistent increase over several weeks where that hasn't declined. That's how we're going about it now, post home testing and tests that we cannot possibly account for, or individuals that are just not testing.
So once you do notify, say that municipality, and then the school district then has to decide, you said, or then has to decide what to do from that
So yes, they do decide as far as the mitigation strategies that are put in. However, the notification takes place regardless because under this new model that we've implemented locally, at least, it's really the notification to the public that's instrumental. So the notification happens regardless of the mitigation strategies that are implemented in that locality. But so you have that public health alert and that notification, and that way the public can gauge the acceptable level of risk to themselves, to their families, but at least the notification happens and they are aware of the broad community acquired transmission that we're detecting.
Thank you.
Absolutely, my pleasure. Should I stay or should I go for the time being? That's always the question. Thank you.
I can give a little, Linda, I can give just a tiny bit more detail on what you're asking about the mental health and schools. So there have been some large trainings done by Cornell Cooperative on trauma and resilience, so early childhood trauma and the effects on kids, training a lot of the school professionals and a lot of the community-based organizations, and that did happen during the pandemic. So I believe that some of the organizations and the schools are slightly better equipped now to deal with some of the trauma that probably happened to the kids from just some of this unknown stuff that was occurring. Also, as part of a grant through Community Health Outreach, we are working with schools and work sites to implement some trauma-reducing strategies with staff, with the students, and with employees at work sites. You know, what they're calling mindfulness now, which is kind of a new coined term that everyone is using, but things that really can help reduce some trauma, whether it's meditation or some of the things that you've participated in with us. It could be, more exercise. It could be yoga. There are many different strategies that we're going to work with the schools to put in policies in place so it will be sustainable. If anyone changes at the school, if personnel changes, if they have different students coming in, right? So this will remain sustainable once we make some policy and some environmental changes by adding some things into the school. This is new. And it's kind of a new journey for us. So hopefully the input that you're giving and all the notes that we're taking, and that becomes part of some of the strategies that we will look for funding for in the future.
I also piggyback too, I mean, of course, the children as well, all across age levels have had a major impact, but also let's think about the educators as well, in the last 2 years with the challenges in public health, speaking for myself included. So if there is any support for educators as well during this time, that would be greatly appreciated.
And I think the Office of Orange County Mental Health does a lot of direct services. Department of Health, through some of our grant funding, will work with the schools and the teachers to provide some of this tertiary, mediation of some of the trauma that teachers also have felt. And we began working with them prior pandemic because teachers also have a lot of stress regardless. So we were doing some things like yoga and some coffee and conversations and working with them on getting some more physical activity, things that were stress relievers anyway. We're hoping with the new round of funding that we received that we can implement more of these strategies. We work with a large number of school districts, and hopefully we will be able to get more funding to work with all of the school districts. I hope that answered your questions. Anything else that we did not answer? And anyone at home, are there any other questions? Okay. Rock voting?
Rock voting.
All right. We're going to move on to the fun part. I think DQ and I were very fun, but we're going to move on to the extra fun part.
Do you want me to speak about it?
Go ahead.
Okay, I got you. So at this time, for the people in the room, you can come right up to the left-hand side and you can participate in the rock voting. Like I said, you're going to be given 2 rocks, and from there you can put them inside of the jars for the 5 priority areas we spoke about earlier. And if you forgot them, they are also going to be up there on flyers as well. And you can put 2 in one jar, or you can separate them and do 1 in each. But the choice is yours, and your opinion and the information that you give us is greatly appreciated. Thank you. And for the people at home, again, I still left the QR code up there as well, so you can participate using the Community Asset Survey. And even after the presentation is done, we will post this on our social media as well, Facebook, and you can get the QR code from there as well.